and a very warm welcome to everyone. Thank you for joining us today's Poshan Ghar webinar on men in nutrition, where engaging men as equal partners in family health and well-being. I am Saroj from Poshan Ghar, and I will be your moderator for today. We truly appreciate your time and continued support as valued members of Poshan Ghar community. Before we move forward with today's insightful discussion, I would like to take a moment to quickly introduce Poshan Ghar to you, especially for those who are new to Poshan Ghar. A detailed orientation for the new members will be organized separately in the following weeks. Poshan Ghar is a UNICEF India incubated platform. It is a multi-stakeholder platform that engages with civil society organizations, academic institutions, non-profits, forums, alliances, and individuals to support the multi-sectoral approach of the Poshan Jan Andolan. It is a non-financial platform and involves no monetary terms. From the Poshan Ghar Secretariat, we have Dr. Lopamudra Tripathi, SBC Specialist at UNICEF India and Poshan Ghar Lead, Ms. Debbie Paul, Manager at Poshan Ghar, and Ms. Sarita Devnath, Outreach and Engagement Associate, along with our esteemed panelists who are also Poshan Ghar members. Before we start, I request all of you to please turn on your cameras if you can and keep your microphones muted. If you have any questions, feel free to put them in the chat box and we will take them towards the end of this webinar. So nutrition is often seen as a women's duty, but achieving true family health and well-being means bringing men to the center at the forefront. And this is what mainstreaming means, especially during Poshan Ghar 2025. Today, we will hear insights, evidence, and ground stories on how men can support caregiving, decision-making, and positive behavior change in their families and communities. We are pleased to be joined by an esteemed panel of speakers who bring deep experience from the field. We have Ms. Alka Malhotra from UNICEF India, Dr. Rubina from Jahangir Medical Research Institute, Dr. Sarita Anand from Roshni Center, and Mr. Rajdeep Solanki from Jatan Sansthan. To begin with, I would like to invite Rajdeep to share his reflections on why men matter in health and nutrition. Rajdeep has over 8 years of experience in girls' education, maternal and child health, and nutrition in Rajasthan. Currently, he is leading projects at Jatan Sansthan aimed at improving nutritional outcomes in the vulnerable communities. Over to you, Rajdeep.
जब हम बात कर रहे हैं कि वाई मेन मैटर इन हेल्थ एंड न्यूट्रिशन, तो सबसे पहले हमें ये जानना चाहिए कि न्यूट्रिशन जब पोषण की बात आती है और पोषण डायरेक्टली रिलेट करता है फूड के साथ में, खाने के साथ में। तो जब खाने की बात आती है तो हमारे माइंड में सिर्फ एक ही चीज आती है, वो जो पिक्चर बनता है वो फीमेल पिक्चर है, चाहे वो माँ हो, चाहे वो आपकी वाइफ हो, चाहे डॉक्टर हो। तो खाने को रिलेट करते हैं हम एक फीमेल जैसे फीमेल प्रेजेंस के साथ में। तो ये जो प्रेजेंस बनी है ये आज से नहीं बनी है। मुझे लगता है कि इसके पीछे पूरा इतिहास में अगर हम देखें तो जब खाने की बात आती है तो हम बात करते हैं कि दादी का खजाना, नानी का खजाना। तो खाने को लेकर हमेशा जो बातचीत होती है वो महिलाओं पर आकर फोकस हो जाती है, वहां पर पुरुषों के ऊपर कोई बात नहीं करता है। तो अगर हिस्टोरिकली भी हम देखें तो इतिहास में देखेंगे तो हम महिलाओं को हमेशा जिम्मेदारी दी जाती है कि जब पोषण की बात आएगी या खाना चूज करने की बात आएगी तो महिला की जिम्मेदारी होगी कि वो अपने परिवार को क्या खिलाना चाहती है। तो ये बेसिकली एक परंपरा शुरू से चली हुई आ रही है कि महिला की जिम्मेदारी होती है कि वो उसके परिवार का ख्याल रखे, खासकर पे खाने को लेकर। तो इस चीज को देखा जाए तो इस उल्टा भी बनाए रखे हुए हैं कहीं ना कहीं, और जहां हम गांव स्तर पर भी देखते हैं इन चीजों को, तो विलेज लेवल पर भी ये चीजें अभी भी चल रही है कि महिला जो है वो केवल घर का काम करेगी, और जब न्यूट्रिशन की बात आती है, जब फूड की बात आती है तो ये सारा डिपार्टमेंट महिला को दे दिया जाता है। तो और पुरुष की सहभागिता की जब बात आती है तो ये देखा जाता है कि पुरुष एक अर्निंग सोर्स की तरह देखा जाता है कि वो अर्निंग करके घर पर लेकर आएगा, और जो डिसीजन खाने से संबंधित है वो लेते थे पुरुष हैं। लेकिन क्या बनाना क्या नहीं बनाना वही था कि जहां हम बात करते डिसीजन मेकिंग को लेकर, तो जब बात आती है खाने को बनाने को लेकर तो वो डिसीजन हमेशा हम फैमिली में देखते हैं कि वो क्योंकि हम इंडिया में बात करते तो इंडिया एक मेल डोमिनेंट कंट्री है, जहाँ पर पुरुषों की बात हमेशा मानी जाती है। और एक परिवार में भी जहाँ बात होती है कि लीडर की बात हो, तो वो हमेशा एक पुरुष ही रहता है। तो जब खाने की बात भी आती है, तो खाने को लेकर भी हम लोग देखते हैं कि ये डिसीजन भी पुरुष ही लेते हैं। तो जहाँ महिला की बात आती है कि जब महिला प्रेग्नेंट है या जब महिला एक बच्चे को बड़ा कर रही है, तो उनकी न्यूट्रिशन की इतनी तवज्जो नहीं दी जाती है शुरू से लेकर। और जहाँ माँ की बात आ जाती है ना, तो मातृत्व और पोषण इन दोनों को रिलेट किया जाता है हमेशा, कि माँ से ही पोषण जुड़ा हुआ है। तो जो पोषण की जिम्मेदारी है, जो न्यूट्रिशन की जिम्मेदारी है बच्चों को लेकर या खुद को लेकर, वो माँ की ही जिम्मेदारी है। उसमें पोषण करता जो है केवल माँ हो जाएगी, तो उसे एक नर्चर का नैरेटिव दे दिया गया है हमेशा से, कि माँ ही इसकी जिम्मेदारी लेगी कि बच्चा या घर में कोई भी फूड बन रहा है न्यूट्रिशन से लेवल, तो वो माँ की जिम्मेदारी होगी। तो ये शुरू से ही बनता हुआ आ रहा है। और इसी वजह से हम देखते हैं कि जो पोषण का ज्ञान या पोषण का जो विज्ञान है, उसको घरेलू काम से जोड़ दिया गया है, और उस पर ज्यादा बात कभी हुई नहीं है पिछले समय में। तो इसको लेकर बहुत सारी धारणाएं भी बनी हुई है। कुछ रीति रिवाज में हम लोग देखते हैं हमारे समाज में कि आज भी जब हम देखते हैं कि कोई महिला जब शादी करके घर आती है, तो महिला को हम लक्ष्मी का रूप तो देते हैं, और बोला जाता है कि पहला खाना जो है वो महिला बनाएगी। तो वहां पर भी महिलाओं को उसी तरीके से प्रेजेंस किया जाता है कि महिला ही कुछ खाना पका के बनाएगी। तो क्यों ना हम पुरुषों का भी उसमें इन्वॉल्वमेंट डालें। तो ये प्रथाएं भी कहीं ना कहीं उसको प्रमोट करती हैं इन चीजों को लेकर। तो वह चीज भी आती है। दूसरा, अगर हम इस पे एविडेंस की बात करें, तो मैंने एक रिसेंटली एक स्टडी पढ़ी थी जो यूनाइटेड स्टेट्स ऑफ गवर्नमेंट की थी। तो जिसमें उन्होंने 2000 से 2012 के बीच में एक स्टडी किया था 13 कंट्रीज के बीच में, जिसमें 9 कंट्रीज में ये देखा गया है कि जहां अगर मेन इन्वॉल्वमेंट रहता है ड्यूरिंग प्रेगनेंसी, तो ये चीज देखी गई है कि उस समय जो एंटीनेटल चेकअप्स होते हैं वो टाइमली होते हैं। और उसके बाद जो डिलीवरी के बाद में जो बच्चे की और माँ की सेहत का ध्यान रखना होता है, और प्रॉपर तरीके से रखा जाता है अगर उसमें मेल इन्वॉल्वमेंट बढ़ जाता है। तो क्योंकि उस समय न्यूट्रिशन की सबसे ज्यादा आवश्यकता होती है एक माँ को और बच्चे को। तो जो मेल पार्टिसिपेशन होता है न्यूट्रिशन को लेकर हो, चाहे या बच्चे की जिम्मेदारी को लेकर हो, तो वहां पर भी हम लोग यही देखते हैं कि जो जिम्मेदारी होती है एक माँ के ऊपर आकर ही रुक जाती है या महिला के ऊपर आकर रुक जाती है। चाहे इम्यूनाइजेशन की बात हो, चाहे हम अभी पोषण माह की भी हम लोग बात कर रहे हैं, तो जो सर्टन एक्टिविटी जो फील्ड में होती है आंगनबाड़ी के ऊपर, वहां पर आप देखेंगे कि वहां पर केवल महिलाओं की ही पार्टिसिपेशन सबसे ज्यादा होता है। तो कहीं ना कहीं पुरुष हमें अभी भी उसी चीज को लेकर चल रहे हैं कि अब ये सारा काम जो है बच्चे को बड़ा करना, और उसका पालन पोषण जो शब्द हमेशा यूज किया जाता है, तो पालन पोषण शब्द हमेशा माँ से ही जुड़कर निकलता है। तो अभी भी उदाहरणें बनी हुई है जिन्हें हमें थोड़ा सा प्रयास करना होगा इसको चेंज करने के लिए। अगर हम बात करें कि रोल ऑफ मेन इन डिसीजन मेकिंग ऑफ अराउंड फूड, तो जहाँ नीति निर्माण की बात आ जाती है, तो हम अभी बात करते हैं कि महिलाएं आजकल डिसीजन लेने लगी है अपने परिवार में। पर फिर भी अभी हम ज्यादातर एरियाज में देखेंगे, रूरल एरियाज में खास तौर पे, तो जो नीतियां बनाई जाती है फैमिली के अंदर, वो एक मेल डोमिनेंट फैमिली ही होती है। और उसमें जो मेल होते हैं वही डिसीजंस लेते हैं अभी भी, कि घर में क्या आएगा, हम क्या खाएंगे, क्या बनाना होगा। तो वो चीज अभी मैंने देखी है। और अगर पुरुष की सहभागिता बढ़ती है, क्योंकि अगर पुरुष ये चाहे तो वो डिसाइड कर सकता है कि जब कोई महिला गर्भवती है या प्रेग्नेंट वुमेन है, तो उस समय उसे क्या न्यूट्रिशन की आवश्यकता है, तो वो उसको भी कर सकता है। तो मेल डोमिनेटिंग है अभी भी हमारी फैमिलीज। तो रोल बड़ा बड़ा महत्वपूर्ण रोल होता है एक पुरुष का परिवार में, खास तौर पे खाने को लेकर। क्योंकि जब भी घर में खाना बनाना होता है, तो एक पत्नी एक माँ हमेशा अपने पति या बेटे से ही पूछती है कि हमें क्या खा आपको क्या खाना है। कभी भी एक महिला की इच्छा को तवज्जो नहीं दी जाती अभी भी, क्योंकि न्यूट्रिशन वैल्यू की जब बात करते हैं, चाहे महिला गर्भवती हो या सामान्य दिनों में हो, हमेशा महिला आखिर में ही खाना खाती है। और उसे वो खाना होता है जो बच जाता है परिवार में। क्योंकि लगता है कि सबका खाने का ध्यान रखना महिलाओं की जिम्मेदारी है, तो वो लास्ट में आती है अभी। चाहे वो महिला लैक्टेटिंग मदर हो, प्रेग्नेंट वुमेन हो, या एक मदर ऑफ यंग चाइल्ड हो। तो इसी वजह से उनका एक जो न्यूट्रिशन है वो कहीं ना कहीं कॉम्प्रोमाइज होता है। तो हम बात कर रहे हैं पुरुष वर्चस्व वाले परिवार की। तो अगर इसमें मेल का इन्वॉल्वमेंट बढ़ता है, तो डेफिनेटली कुछ चेंजेस होंगे कि हम क्योंकि एक टर्म मैंने बीच में सुना था कि कहीं इंटरनेट पे, कि मैं भी बाहुबली। तो ये एक इसमें एक स्टोरी मैंने देखी थी कि अगर कोई व्यक्ति चाहे तो अपने परिवार का, जब कोई महिला कंसीव करती है उसके बाद से उसके जो ध्यान रखना होता है, अगर पुरुष इस चीज पर बराबर ध्यान रखता है तो कहीं ना कहीं उसके न्यूट्रिशन पर और जो बच्चा होता है वो भी स्वस्थ पैदा हो सकता है। तो मेन की इन्वॉल्वमेंट बहुत जरूरी है इन चीजों के अंदर।
Thank you, Rajdeep. This was really elaborative and you gave a lot of examples. So you have set the context right. Now, building upon this, we will now move to Dr. Sarita Anand, who will speak on men as health and nutrition enablers at home. And for that, I will now give it over to Sarita. But before that, I just want to introduce who Dr. Sarita Anand is. She is the head of the Department of Development Communication and Extension at Lady Irwin College, University of Delhi. She also leads Roshni Center, Center of Women Collectives led social action, supported by UNICEF India. Sarita has over 3 decades of teaching and research experience. She has worked extensively with national and international agencies on communication, gender, and development. So, over to you, Sarita, and I will be presenting your slides.
Thank you, Saroj. गुड आफ्टरनून एवरीवन। सब लोग जो हमारे साथ जुड़े हैं, सब लोगों का इस कार्यक्रम में स्वागत है। और जैसा कि सरोज ने कहा और उसके बाद राजदीप की बात को आगे बढ़ाते हुए, आई विल ट्राई टू टेक इट लिटिल फॉरवर्ड टू से दैट there is this understanding which we all say that India is a patriarchal society, therefore our behaviors are largely governed by how society perceives what men and women should do. And when society perceives women should be the caring, should perform the caring roles, and men should also be in a role of provider. So if we are able to expand that role of a provider as a caregiver as well, that is what we have to cross the bridge for. And therefore, what we have attempted as an experiment, as a pilot, we did it in Chhattisgarh and in Bastar block. And our research evidence now shows that when you intervene, you work in a methodology as a strategy to engage men and communities, you are able to make a positive change, a change towards men more as enabler, specifically to improve outcomes for food, nutrition, and childcare. And let me just put you across to certain, figures and data. For example, there are studies done in Cambodia, there are studies done in Bangladesh, there are studies carried out in India. So in our Southeast Asia and Africa, which are the developing nations, we find that there are few pilots which have tried to establish that to change the complementary feeding practices, to change institutional delivery practices, which ultimately influence the family's decision making on where to, go for the delivery of the child. What would a woman be able to eat immediately after delivery? How soon a baby is put to the mother's breast? If there is anything given to the child before mother starts breastfeeding, can we make some changes which are more positive change behaviors, and if we can show them through certain role models. So what I would like to highlight, what you can see on the screen right now, is that I will definitely be happy to take your questions, but since I'm just trying to highlight this one slide, so I will first try to explain that to you. So our experiment started with a pilot, as I said, done in Bastar. And in Bastar, we use, because there was research going on already in that area, where young adolescent girls and women were being exposed to information on positive changes in health which is required. For example, how to prevent anemia, use of iron folic acid tablets, going for institutional delivery, husband and wife, the young couple coming to a Mahila Mandal meeting and receiving a suitcase in which there were essential things which were being provided, which these essential things were like the use of the contraceptive and things of this kind. And because in marriage, as you receive gifts, so it was considered as a continuation of that ritual. So it is a kind of a community event where that new couple is invited. They are gifted with this suitcase, which has all the essential things, including umbrella and few such things, which are required in the community. And plus, in addition to, have a conversation around use of contraception and be delaying the pregnancy, as in certain norms we know that as soon as a couple gets married, there are expectations to have a baby soon. So in order to do that, this kind of a ritual which helps to break the ice and have conversation, and because in Mahila Mandal meetings otherwise men don't come. So we had this experience, and therefore working for some time, and when the research study reached up to the time of mid-review, we realized that certain indicators were not moving, and we really needed to something more intensive to understand that why these indicators were not shifting the way we wished them to. And we realized in our conversations with young women, adolescent girls, that it is the family environment, because they are not the sole decision makers. So it is the family environment which helps them to do certain things, or which kinds of creates resistance for certain actions. For example, going for antenatal checkups or going for institutional delivery. So these were certain things which they mentioned in the conversations, that it is if the family is also of the same view or enables it, they are able to change. Otherwise, this change is difficult to bring in. So that brought us to a kind of a back to the table, and where we said that because we were working with women's self-help groups, which by design are supposed to be working only with women. And therefore, how do we interact with men if women are saying that if you keep talking to us, there is a ceiling, we hit a ceiling. And therefore, we have to expand the scope of our conversation. And the conversation this is just not individual, talking to a woman or a girl, not just family, but also at the community level, the setting. Because if you have to shift social norms, talking to individuals or families is not enough. If you are setting up or moving towards setting up an alternate norm, you have to have a community acceptance to that idea. Very few people will have the courage to have this battle at an individual level. But if we are able to create that environment of acceptance to an alternate norm, it becomes easy for families to take decisions accordingly. So the strategy, we worked with several organizations which had been working with mainstreaming, men's into participation development, and various other experiments. Various organizations came, and learning from that, we wanted to understand that what in that particular context was an opportunity to talk to men and community. So this is what this picture is talking about. So we used 3x3 strategy, wherein beyond the women self-help group members and the adolescent girls, we wanted to tap into the power and the potential of decision-making of husbands, mother-in-laws, and local healers. And for them to come together, because they technically cannot come into a self-help group meeting, which is a women's group meeting, which is around economic gains, and therefore it becomes an attraction for women to come to these meetings, because they can take loans and they can use those loans for families' consumption or investment purposes. So because this was an attractive window, and men, whenever we had these conversation or games, etc., interaction, we saw men standing on the periphery, being there, enjoying, and they wanted to, they would pass comments, they would say something, they wanted to be there, but they were actually technically not in the meeting. So experimented with this idea, and we used a potential platform within the community, which is Parivar Chaupal, which is a meeting once a month, which happens wherein all the panchayat members, all the frontline health workers, and all these women and men are there. And our Poshan Sakhi, or our women community resource person, which has been given the responsibility to have conversations around nutrition, she was able to mobilize these people. And again, there was an experiment wherein we divided the 3 by 3 strategy was these 3 target groups, and 3 key messages were that we did not want our young mothers to eat last and least. So that was our first crucial message. Second was no early marriage. And third was after marriage, planned pregnancies and space between the pregnancies, because these 3 things will ultimately lead to better health outcomes. So looking at this 3 by 3 strategy, so engagement of community, PRI members, frontline health workers, and in our context, it was Sira Gunia, the local healers, who also made a lot of influence, specifically in terms of institutional delivery and antenatal checkups. So this is how, Saroj, you can remove this slide now. Thank you. So this is how what the strategy was all about. And it showed us that it had an influence because we were able to speak to men. And another hurdle which Rajdeep highlighted, because communities are used to hearing men as, information providers, men as providers in general, providers of food, provider of health services, providers of information, making families take services, whether it is a service from a PDS, service from a health functionary, going out to seek any help, any kind of entitlements, the men take the lead role. But our community resource people who are women and have been doing that for the group. So for them, we first had to cross that hurdle of building their capacities to address a group within the village community where men as well as women both were sitting. And it took us 1 full year to complete that capacity building process, wherein those women said that yes, they feel now capable to speak about that. They were able to overcome that resistance because elderly men, elderly women of their communities were sitting in the same groups, and if they had to address a meeting, it took a lot of courage and lot of shedding a lot of inhibitions to talk amongst them. And after that, once this set was done, we divided our meetings into 8 meetings. So as I said, 1 meeting in a month. So every meeting goes with 1 key message, and we divided it into life cycle approach. So we started with talking about early marriage. We then that why it is important to delay marriage, why it is important to have a body which is able to give a birth to a healthy child, and the maturity of the couple who is taking a decision to get into parenthood. So this conversation became important. So there were inhibitions to talk about family planning. Now we see that our young Poshan Sakhis are able to talk about alternatives available for family planning, etc. So then we moved on to antenatal checkups, we moved on to institutional delivery, then we go on to talking about postnatal care, immunization. We then are able to talk about the achievement of right milestones for the health. And then our focus comes on to talking about nutritious food, and then talking about the myths and myth conceptions regarding food. For example, what to eat, what not to eat. There are conceptions about which part. For example, in Bastar, we found that fish eating is a common food practice. So it is not that non-vegetarian food is not eaten, but which part of the fish is eaten by whom becomes a key this thing, because something which is considered to be more nutritious is generally served to men and boys, and something which is considered not so nutritious or more gravy or more diluted form of it is consumed by women. So our conversations are around this. And then the last is about the care for the child. So care, giving bath to the child, cooking a complimentary food meal for a child, use of Shri Anna, which was being promoted 2 years ago when we started this experiment. So we kept one of the meetings wherein we talked about the kodo, kutki, which are the local millets which are to be consumed there. So, what I'm trying to convey here is that there are possibilities, and this kind of efforts to engage men into conversations around women's nutrition and health, where we use their agency and the traditional viewpoint that they are the providers, we make them as in the conversation through the role modeling, that they definitely, it's an extension of that role, which is much more than just bringing money to the family. It is that what do we do with that money, how optimally, how well we can utilize it, and also being insensitive to that. We just if time will permit, Saroj will play that film, that if the family can eat just one meal together, we will be able to kind of offset certain biases. So these are certain things we have been able to do. But to say that this is something very easy to do, or it will not have any kind of hurdles, uh, it will be naive. We all understand that there are challenges. We also face certain challenges, and more than us, it was the group of our community resource women who told us that this is and these I talked about these 8 meetings. So what will go into each meeting, with what game will this be done? There will be a taraju game, or there will be different, the methodology to transact on those issues were co-created with the women. So it was a participatory engagement. If the people here already know about PLA, participatory learning and action, so we use those techniques to conduct this meeting, which goes on for about 30 to 45 minutes, talks to men, has role for everybody. And then they are able to kind of set up, people would laugh, enjoy, reflect. And in the initial meeting, sometimes men are quiet. Gradually, after third or fourth meeting, they start coming out, they start talking. And once they start talking and show a kind of an ownership to this change of an idea, we feel that this becomes possible. And for communities to adapt to a certain behavior, they're not only convinced when they see it on a film or a movie or a show or a role play. Once they see it happening very close in the neighborhood, in the community, that is when they are able to have that courage to make that change for themselves. We'll be happy to hear the next 2 speakers, and at the end, if there is any question, I'll be happy to take it. Thank you.
Thank you, Dr. Sarita, for such a detailed case study. I mean, there are various aspects that we can talk about, but without further ado, just building upon what you and Rajdeep has said, we will move to the third segment where we will explore what are some of the key challenges that limit men's participation in health and nutrition. And for that, I invite Ms. Alka Malhotra. Alka is a social and behavior change specialist at UNICEF India. She spearheads SBC strategies on child rights issues, leads communication research, and UNICEF India's work on behavior science and behavior insights related to health, nutrition, water, sanitation, hygiene, education, child protection, and responsive parenting. So over to you, Alka. I will be presenting your slides.
Thank you so much, Saroj. Thank you, Rajdeep ji. Sarita, very beautifully put. That men's participation is not that they don't desire to participate, but there are several other challenges which exist. If you could move to the next slide. And what I've tried to do is to situate the challenges. Rajdeep ने भी challenges की बात करी, सरिता ने बात करी कि किस तरह से कुछ नहीं होती. Sometimes they don't know. Other times they do know, but they don't know how to overcome the social pressures. So there is family pressure, there is economic pressure, there is the breadwinner pressure, and then there is this entire infrastructure related issues. So sometimes they don't have the agency, then don't have the ability to speak to other men in the family and say, no, I'm going to provide, I'm going to care, I'm going to cook today. These are role models that we would like to see, but we also understand that men do not necessarily take up these roles. तो हम लोग प्लानिंग के लिए ये सोशियो इकोलॉजिकल मॉडल यूज करते हैं, जिसमें राइट एट द बॉटम इन द डीप ब्लू सर्कल इज द इंडिविजुअल, और हमें पता है दैट दिस इंडिविजुअल इज एक्चुअली नॉट एक्टिंग इन अ वैक्यूम. वो इंडिविजुअल उसके आसपास होती है इन द लाइटर ब्लू सर्कल हिज फैमिली. So the individual, the man who's at the center, is surrounded by his families and friends, and this is where he sees role models. This is where he faces ridicule. This is where he faces appreciation, and then his behavior is constructed. Above that is the community. तो हाँ, गांव में क्या हो रहा है, मेरी आसपास मेरे शहर में क्या हो रहा है, मैं मीडिया पे क्या देखता हूँ, all of that determines the community, and that becomes the reason why any man is reinforced to continue to act in a certain manner. उसके ऊपर आती है इंस्टीट्यूशंस, जहां से सर्विसेज मिलती हैं. सरिता ने बहुत अच्छे से समझाया कि विलेज चौपाल इज अ काइंड ऑफ एन इंस्टीट्यूशन, द हेल्थ सिस्टम इज एन इंस्टीट्यूशन, स्कूल्स आर इंस्टीट्यूशंस. तो जहां पर कुछ जानकारी पुरुषों को मिलती है. एंड लास्ट ऑफ ऑल इज द पॉलिसी फ्रेमवर्क विद इन विच वी ऑपरेट. इफ यू कुड मूव टू द नेक्स्ट स्लाइड. अब ये जो चैलेंजेस हम लोग पुरुषों के साथ चैलेंजेस की बात समझ रहे हैं कि क्यों वो केयरिंग में नहीं आना चाहते, क्यों उनका लीड रोल नहीं है न्यूट्रिशन में, तो हम इन चैलेंजेस को हर एक गोले में स्थित देखते हैं. जैसे फॉर इंस्टेंस, at the individual level, there is this whole aspect of poor awareness about nutrition and caregiving practices. हमने जब पेरेंटिंग के ऊपर काम शुरू किया था, तो हमने एक स्टडी करी थी कि पेरेंटिंग में पुरुषों का और महिलाओं का क्या रोल रहता है. We know that caregiving is a woman's role. But we also know that when a new child is born in the family, the father is as excited to hold the child as the mother is or the grandmother is, because there's a new person in his life, and he also feels that affection for the child. तो हमारे ये देखा गया कि उनको डिजायर डेफिनेटली थी अपने बच्चे की न्यूट्रिशन, अपने बच्चे के साथ खेलने की, बट देयर वाज अ ह्यूज lack of awareness about what to do. So there is knowledge gap. What shall I do? How shall I hold my child? There is a skill gap. How shall I cook? I've never cooked. My mother never let me into the kitchen. Much as I would like to make tea for you, I don't know how to do it. So at the individual level, there is a knowledge gap. There is a skills gap. And there is also then, of course, this understanding and attitude that this is something that is meant to be done by my mother, by my wife, by my sister, because that is how I have seen it reinforced in my entire childhood. तो अब वो हम एक दिन में वॉश ऑफ नहीं कर सकते हैं. वो स्किल गैप और नॉलेज गैप को हम एक दिन में नहीं मिटा सकते हैं. हमें पुरुषों के साथ भी उसी तरह से एज सरिता वाज सेइंग काम करना पड़ेगा. उन्हें भी कुछ आइडियाज देने पड़ेंगे, और इसके पेरेंटिंग के लिए हमने सबसे पहले तो आप क्या कर सकते हैं और किस उम्र तक क्या कर सकते हैं और किस उम्र तक कुछ नहीं कर सकते. फॉर मेन द इम्पॉर्टेंट थिंग एट द टाइम ऑफ पेरेंटिंग वाज कि अगर मुझे करना ही है तो मैं अपने बच्चे को अपना मोबाइल फोन दे देता हूँ. अरे वो आपको नहीं देना है. तो ये जानकारी भी देने कि ये चीज आप करनी चाहिए और ये चीज नहीं करनी चाहिए, which means a dialogue with men. If you could move to the next slide, Saroj. अब हम अगर हाउसहोल्ड लेवल पर आते हैं, आई ऑलरेडी मेंशन्ड इट दैट women household norms are very very restrictive. और उसके अंदर एक महिला को एक किचन वो समझती है कि किचन उसका उसकी स्पेस है, तो इसीलिए उस स्पेस को भी शेयर करना उसके लिए उतना ही मुश्किल है जितना कि उस पुरुष को उस स्पेस के अंदर घुसना. तो इट नीड्स टू वर्क एट बोथ लेवल्स. पुरुषों को भी चाहिए कि वो फूड और चाइल्ड केयर के अंदर आए, और महिलाओं को भी चाहिए कि वो थोड़ी सी उसमें स्पेस दें. और ऑफन टाइम्स जो है इस लेवल पे, फैमिली के लेवल पे, ग्रैंडफादर ग्रैंडमदर जो घर के बड़े बूढ़े हैं, उनका रिडिक्यूल, उनकी रेजिस्टेंस आ जाती है कि नहीं, ये महिलाओं के काम है, ये आपको नहीं करने चाहिए। एक चीज जो हमने मेटर्नल न्यूट्रिशन में पाई कि मेन आर अर्निंग, और डिसीजन फैमिली में क्या खाना चाहिए ये उनके स्वाद से डिटरमिन होता है। तो पुरुष पैसे कमाते हैं, पुरुष सब्जी की खरीदारी करते हैं, सो दे डिटरमिन व्हाट इज गोइंग टू बी कुक्ड। when they do not know that हरी पोषक सब्जियां is meant to be cooked for the woman for the betterment of maternal nutrition, they do not buy that product and bring it to the family. They buy what they would like to eat and come into the family. So even understanding at the family level, a dialogue on what is tasty, what is not. There was one of these films that लापता लेडीज, अगर आपने ध्यान से वो फिल्म किसी ने देखी हो तो माई डॉटर इन लॉ और मदर इन लॉ में बात हो रही होती है, और वो डॉटर इन लॉ मदर इन लॉ से पूछती है कि आप क्या खाना चाहोगी। तो मदर इन लॉ का जवाब आता है कि मैं तो जिंदगी में कभी सोचा ही नहीं कि मैं क्या खाना चाहूंगी, क्योंकि ये डिजायर तो मेरे से कभी किसी ने पूछी ही नहीं, मैं तो वही खा लेती हूँ जो सब बनाते हैं। तो कौन खरीदता है, किस तरह से खरीदा जाता है, और उस what is determining that, and is there a dialogue at that conversation also is something. So decision making, which is dominated by men, oftentimes becomes a challenge to nutrition, because उन्होंने कभी पूछा ही नहीं कि आप क्या खाना चाहोगी या आपकी सेहत के लिए क्या अच्छा है। So if you could move to the next slide. At the community level, this is why social norms are constructed. तो जहां पर हम देखते हैं कि महिलाओं को ऐसा काम करना चाहिए और हम एक्सपेक्ट करते हैं कि मैं भी ऐसा ही करूंगी, क्योंकि ऐसा फेमिनाइज्ड रोल्स जो है वो सब जगह से मुझे रीएनफोर्समेंट में मिल रहे हैं। मैं देखती हूँ कि सब जगह महिलाएं किचन के अंदर हैं, इसीलिए मैं समझती हूँ कि मुझे भी किचन में जाना चाहिए। मैं देखती हूँ कि सब जगह महिलाएं बच्चों को VHND में लेके जा रही हैं, तो मैं सोचती हूँ कि मुझे भी वही लेके जाना चाहिए। सो देर इज अ नीड फॉर एट द कम्युनिटी लेवल मोर मेल रोल मॉडल्स, एंड सरिता स्पोक अबाउट दैट, जहां पर हम लोग कन्विंस कर सकें कुछ पुरुषों को इस काम को लेने के लिए। राजदीप स्पोक अबाउट दैट कि कैसे पुरुष बढ़कर कोई अपने आप को दिखा सकते हैं एज अ रोल मॉडल, एंड देन ऑफ कोर्स वी विल मेक दैट हैपन एज अ नॉर्म। एक चैलेंज यहाँ पर बहुत स्ट्रॉन्ग है, एंड जस्ट मूव टू द नेक्स्ट स्लाइड, जो हमारी एक्सपीरियंस में बार बार उठ के आता है कि पुरुषों को एंगेज करने के लिए हमारे मोस्ट ऑफ आवर सोसाइटीज पुरुष ही पुरुष से बात करता है, और हमारे पास बहुत, नेक्स्ट स्लाइड, ऑन द इंस्टीट्यूशंस, हमारे पास बहुत इंस्टीट्यूशनल प्लेटफॉर्म्स बहुत कम हैं जहां पर पुरुषों से बात की जाए। जब हम पेरेंटिंग पर काम कर रहे थे तो एक चीज उठ के आई कि आंगनबाड़ी कार्यकर्ता, बात तो समझ आ गई कि पुरुष चाहते हैं कि वो अपने बच्चे की परवरिश में शामिल हों, बट इट इज नॉट पॉसिबल बिकॉज दे डू नॉट नो how to engage with this very young child. They don't even know how to hold the head, how to support the head, how to hold the baby. So these are skills that they need to learn. So what we found was that when we spoke to Anganwadi workers and Asha workers, they do not have the skill set. They are both, वो गांव की बहू है, आंगनवाड़ी कार्यकर्ता और आंगनवाड़ी और आशा कार्यकर्ता मोस्ट प्रोबेबली गांव की बहू रहती है। गांव की बहू बिना घूंघट डाले पुरुष के साथ बात भी नहीं कर पाती है, तो वो किस तरह से एक यंग आदमी को समझाएगी कि उसे बच्चे को किस तरह उठाना है। So there is a need for institutional platforms, service delivery platforms that engage with men, and they have to be men. तो मल्टीपर्पज वर्कर्स एक जमाने में हुआ करते थे, वेटरनरी सेक्टर में बहुत सारे एनिमल हस्बेंड्री के मेल कार्यकर्ता हैं, उनको किसी तरह से हमारे को इस कार्यक्रम में जोड़ना पड़ेगा, so that we are not women talking to women, we are not Anganwadi workers, SHG women, community women talking to other women about caregiving. Where is the male interface the male role model who is also part of the system. सिवाय पंचायत कार्यकर्ता के हमारे को दूर दूर तक पुरुष कार्यकर्ता नहीं मिलते हैं in these spaces, in nutrition and health spaces. हमारे को इन spaces में husbandry, multi-purpose worker, literacy worker, इस space में पुरुष मिलते हैं. Somehow we need to bring those men into the envelope of nutrition conversations, of health conversations, of caregiving conversations, so that they become, they can be the role models moving forward. I have a last slide, which is essentially a segue into the next session around what might we need to do. हमारे को collective action की ज़रूरत है. ये role models मीडिया में दिखने चाहिए. हमें किचन में पुरुषों को देखना है. हमें पुरुषों को खाना खिलाते हुए देखना है मीडिया में, socially. और हम लोग at an individual level, knowledge, cognition, अंडरस्टैंडिंग, ये हमें इंडिविजुअल लेवल पे बढ़ानी है और सोशल लेवल पर हमारे को एक मूवमेंट क्रिएट करनी है. तो इसीलिए इन दोनों के बीच में दोनों को इकट्ठे चलना पड़ेगा और तभी जाके हम पुरुषों को इस पूरे इस सेक्टर में सेंटर स्टेज ला सकते हैं. बिकॉज बिना पुरुषों के 50% ऑफ द बातचीत हम नहीं कर पाएंगे किसी से भी. With that, I stop and I'm happy to take questions whenever we have scheduled for questions. Saroj, back to you.
So, Alka, this was really beautiful to see how you put all these challenges, the list is long, but into a framework where we can comprehend those challenges. Now, building upon this, we are moving to our last segment where I invite Dr. Rubina Mandalik to guide us on practical strategies and pathways for change. Rubina is a public health nutrition researcher with over 15 years of experience in maternal and child nutrition, infant and young child feeding practices, food environments, and behavior change communication. And she has also authored 34 peer-reviewed publications. Rubina, over to you.
I would like to thank, of course, Saroj and the Poshan Ghar team for providing me this opportunity, and to all the speakers who presented before me. I will mostly be building upon the foundations that these esteemed speakers lay, and to a certain extent reiterating a lot of the points that they spoke as I take you through the practical pathways by which men can be engaged in nutrition and health. What we've seen is that men do matter in nutrition. However, nutrition and health have traditionally been historically focused towards women, both as the end users as well as the providers. And this has alienated men from the so-called female domain of family planning and nutrition, and thus has reinforced the imbalanced gender roles that we have. So we are well aware that men influence food purchases, they influence child feeding, healthcare decisions. And there have been several studies in India and other low-income and middle-income countries that have shown that engaging men improves family nutrition and health outcomes. Now, I'll take you through 3 levels of engagement. So we start off with household actions that men can take to practically engage with nutrition and health domains. So they can function by supporting mothers with breastfeeding, by helping them with their chores, and by providing emotional support. They can share in decisions related to food and health. They can participate in child feeding and meal preparation, and also encourage family meals with nutritious foods to set a positive example for their children. Now, in a lot of the work that we've done, we've been able to come across this where men have a lot of influence on what their children eat. Because during one of our focus group discussions, we had this grandmother who told us that the grandchild only eats egg when the father sits down and eats it. And then there was another example where a mother said that her husband enjoyed eating snacky foods like chaklis, etc., along with his meals. So whenever he sat down to eat, she had to send her little baby out along with his other siblings so that he wouldn't be led to eat these foods as his father does it. So she has to be bothered about his nutrition, but she also has to take care of her husband's requirements and whatever he needs, which made it a great burden for her to ensure that her child eats well. And it's in this area that men when made aware, can be a very strong positive influence on how their children choose food. Saroj, you'll have to move to slide number 4 now. Yeah. So we are coming to our second level of community actions. Community actions can be had in the form of peer engagements. And I think peer engagements are best had in spaces that men are comfortable with. For example, in their workplace, probably at the chai ki tapri, maybe at popular male hangouts. In a rural area, it could be farmer groups. Community engagement can be in the form of champions and role models at the local level. Of course, schools and self-help groups can be very good engagement platforms, and a fostering of couple activities, especially during festivals. Like there's a very common practice in Maharashtra where the women and the men, they do what is called ukhana. Ukhana means they have these small couplets that they write, and they use that to take their husband's name, because traditionally women don't call their husbands by their name. So it's through activities like this which individuals can culturally relate to. It's using activities like this that you can send across messages of nutrition and health awareness. Um, Now we come to our next slide of system actions. And I think over here, one of the important points that was raised by the rest of the speakers as well was having male volunteers in Poshan programs. Um, as we are well aware, majority of our frontline workers are females, but it would definitely help to have a male volunteer and a male role model who can engage with men on their level and in their comfort zone. Additionally, mass media and social media campaigns, these can be used as important ways to engage with men, especially if there are effective ads that are relevant to the local population and are aired during prime TV time. Workplace policies that support shared caregiving. So at systems level, this is a major um, supporter and a motivator to men, so that workplace policies could be in the form of paid leaves so that the fathers can accompany the family either for maternal health care utilization, for child immunization and related needs. This brings us to the next slide, behavior change approaches. And I think I would first like to stress upon what Alka ma'am spoke about, and that is having an intergenerational approach. So we don't just deal with one or the other individual um, in silos or separately. I think the best behavior change approach to deal with or to work towards including men in nutrition is an approach that targets all three aspects or the whole family unit. So it's not just the men, it's not just the women, it is also the parents of that adult couple as well as children if they are there. What happens when you do this is, I believe that, and through a lot of the work that we've done in our institute, we've seen that it helps to start working with children early. We talk about working with adolescents, but I think even that stage is a little too late. Uh, when you start working with children, and they are a very good captive population when they are in school, that's a very nice age where they can be easily molded to be able to understand what um, decision making or shared decision making looks like. Additionally, the parents of that couple need to be engaged because, as speakers before me have said, they can be the ones who are resistant to these changes due to previous experiences and expected traditional roles. A suitable place and a time is paramount when you are engaging with men. From our experience, we found that we tried to assess height and weights of fathers, and it was one of the most difficult things to do because they just wouldn't come to the center. We were not able to find them even if we went to their houses because they were working. So it meant that my team had to go early in the morning or in the evening, if not that, then on a Saturday to be able to collect their anthropometric measurements. So it's very important that we find a time that is very suitable for adult men, and this generally happens to be evenings or the weekends. Schools are a very powerful platform again, and influencing children early is very essential. Um, then we come to gender transformative messaging. I think it's essential to use the traditional roles that have been accepted, because if you challenge them a little too much, it will lead to a lot of resistance. So instead of that, building upon those traditional roles, for example, you have the traditional role of a man being a protector role. So you reframe this protector role for the man to be able to, and tell the man that he's expected to be the protector of his family, protector of the health of his family, protector of the nutritional status of his family, protecting his family from becoming sick. This is what the protector role can now encompass. Once again, reiterating, you individuals need to be engaged early. Once they are married, it's a little too late for engagement. Not like it's the wrong form of engagement, but I think best engagement happens before habits and um, roles have been formally fixed in behaviors. We find that a lot of content is easily taken up if it is delivered in locally relatable format. For example, we ran a series of social behavior change communication sessions. We used what is called Pravachakars in Maharashtra to be able to deliver this message. So they delivered pravachans, and through those pravachans talked about health and addictions. And we found that a lot of our uh, cohort participants were very interested, and we always had a full session whenever the Maharaj was was delivering the sermon. Um, yes, another important thing is that when you are working with teachers, when you're working in schools, it's very important that the teachers are equipped to deliver gender transformative messages. I remember when I was doing my PhD um, in the school, the teachers would call the students after they were done with their lunch to sweep the area where they had their lunch. Now, that itself is not acceptable. But what was further unacceptable is that they didn't call all the children. They only looked for the girls to come and sweep up the area where they were eating. So, if we want to deliver gender transformative messages, it needs to start with teachers being equipped to deliver such messages. Saroj, can you please go to the next slide? Yes. So currently, we see that men are seen at two extremes, either as decision makers to be served or as occasional helpers. And our goal is to be able to move beyond this spectrum to engage men as true partners and supporters in the family nutrition. For this, it is essential that we need to help men unlearn some traditional roles and build skills and mindsets for shared caregiving. And this requires an intergenerational approach. So, to the next slide. And a shift across generation requires one, demonstrating shared decision making and gender inclusive life skills to children early in schools. It requires supporting men to take on partnership roles in caregiving and nutrition. And it requires engaging parents of adults who may struggle with changes to the traditional gender roles. So, go to the next slide. Yeah. So, effective engagement, like I said, and reiterating, is required at the household, community, and the systemic level. And for sustained behavior change, the choice of place and time of engagement, reframing of gender norms to become transformative, and role models and local content will be something that you will find very useful when you go about designing interventions in this area.